How is dog degenerative myelopathy diagnosed? If you have noticed your dog struggling with mobility, you may be wondering how veterinarians diagnose dog degenerative myelopathy. This condition affects the spinal cord and can lead to progressive weakness. Let's break down the process veterinarians use to diagnose this condition effectively. The first step in diagnosing dog degenerative myelopathy is a thorough clinical assessment. A veterinarian will conduct a physical and neurological examination. They will look for signs such as weakness and loss of coordination in the hind limbs. The dog's breed and medical history are also important. Certain breeds, like German Shepherds and Pembroke Welsh Corgis, are more prone to this condition. Next, diagnostic imaging plays a key role. X-rays, also known as radiographs, are usually the first imaging tool used. They help rule out other issues like hip dysplasia or arthritis. However, X-rays do not show soft tissues well. For that reason, advanced imaging techniques like magnetic resonance imaging or computed tomography scans may be performed. These tests can help identify problems like intervertebral disc disease or spinal tumors. Keep in mind that these advanced imaging techniques often requiring general anesthesia. Another method used is myelography. This involves injecting a contrast dye around the spinal cord followed by X-rays. It helps detect any spinal cord compression that may be present. Laboratory tests are also essential in the diagnostic process. Blood work can help exclude other systemic diseases that might cause similar neurological signs. Additionally, a cerebrospinal fluid analysis may be performed to rule out any inflammatory or infectious diseases affecting the spinal cord. However, collecting this fluid requires anesthesia and can be stressful for the dog. Genetic testing is another tool in the diagnostic toolbox. A DNA test can identify mutations in the superoxide dismutase, one gene associated with dog degenerative myelopathy risk. Dogs with 1 or 2 copies of this mutation are at a higher risk. However, not all dogs with the mutation will show symptoms, making genetic testing a supportive tool rather than a definitive diagnosis. Finally, the diagnosis often involves exclusion and monitoring. Since dog degenerative myelopathy shares symptoms with other neurological conditions, it is essential to rule out other diseases through the tests mentioned. A definitive diagnosis can only be made through a histopathological examination of the spinal cord tissue, which is only possible after the dog has passed away. In practice, veterinarians relying heavily on the dog's clinical signs, breed predisposition, neurological exam findings, and genetic testing to make a presumptive diagnosis. This process can take time and requires careful interpretation to avoid misdiagnosis. Early and accurate diagnosis is vital for managing the disease effectively. It allows for supportive care and helps guide owners on prognosis and quality of life considerations. While there is currently no cure for dog degenerative myelopathy, physical therapy and mobility aids can help maintain function and improve the dog's quality of life.